Hello, hello. Hey guys. Start. That's my husband. He didn't know I was live. Commercial. All right, give a couple more seconds here. So hello, how's everybody doing this week? Hopefully some of you had the day off. All right, so just quick touch base with everybody. So real quick, we'll just go over our all of our February specials that we still have currently going on. So we have the PRP joint injections or pain injections. Hi, Lydia. No. So this is good for anybody who's suffering with, for instance, today I had a guy with plantar fasciitis. So I did a PRP injection for him. Hello. I'm watching myself on Facebook. But I can also do joint injections. Like for my dad, I did his thumb injection. I did my knee the other day. So usually those are $150 per area. And right now they're $100 per area. So a little bit of savings on that. So if you got something that's been bothering you, now's a good time to come in and get it fixed. The other thing we're offering is Sculptra. So that's a biostimulating agent from the makers at Galderma. They're the same people who manufacture Dysport and Restylane products. This product is under the filler umbrella. However, it does help your body to stimulate its own collagen production. So typically we say 1 vial for every decade of life past 30. So usually people will need 3 vials, and I'll do 2 at one time. So 1 vial on each side of the face, and then you wait about 4 to 6 weeks, and then you do another vial, and then you kind of give it some time to let your body do its own thing and reevaluate at about the 3-month mark to see if we need to do a little bit more. That's when you will typically start to notice a lot of the differences is at that time frame. Then every year you'll have a Sculptra birthday. So that first treatment that you had is going to be your Sculptra birthday and your anniversary. So you'll treat yourself to a Sculptra treatment on that time every year. So usually those vials are $5.99 each. Right now they're $4.99 each. So the package of 3 is $14.97, as opposed to without the sale price, it's $2,100. The other package we have right now is for the Bio Repeal. So this is a peel that is especially good for those of us who live here in Florida because it's not photosensitive. So what that means is some of the other peels and lasers, you've got to be out of the sun for 2 weeks before or 2 weeks after. And this one, you don't have to do that. It is sun friendly. So usually we do a package of 3. It's very good for acne scarring, fine lines and wrinkles, skin tone, skin texture, hyperpigmentation, those kinds of things. And regularly a package of 3 is $600, and right now it's $447. So I state this before in my previous videos, even if you guys are not needing these treatments at this time, you can pre-purchase them at these prices, and then we'll just keep those treatments on your books until you're ready to do them. The other one we have is a laser treatment. It's called a Resurfix. So that is also done as a package of 3, 1 treatment a month for 3 months. Resurfix is good for fine lines and wrinkles, hyperpigmentation. I've been doing my neck to try and kind of get these wrinkles and stuff. I've done a couple treatments. Not in the time frame that you're supposed to do them because we don't always have time, but I'm trying. So typically a package of 3 of those is $1,500, and right now it is $997. We've got the body sculpting package. So this is the machine that helps you build muscle and burn a little bit of fat. Typically, people will do their abs or their glutes or their quads. Some people do their biceps or triceps or shoulders, stuff like that. When you start the treatment, you do 1 treatment a week for 4 weeks. And then after that, you do a monthly maintenance treatment. This is something that should be combined with a healthier lifestyle, healthy eating, and just working out. So it's not a replacement for that. It's something that can be added to that to kind of give you a little bit more benefits. So usually that for those 5 treatments is $1,400. And right now it's $899. So you'll get the 1 treatment every week for a month, and then that first monthly maintenance included in that. As a reminder, we are offering peptide services. So these are peptides in addition to the tirzepatide and the semaglutide. Those are the weight loss medications, but those are also a peptide. So I'm offering several different peptides. A lot of them are along the lines of anti-aging, like the NAD+, that's a big anti-aging one. And then some of the other ones are to help with sleep, to help with sexual function, or to stimulate your own growth hormone, help you burn more fat, and build some muscle. So I've got a ton of those to offer, and usually you'll do it like a stack of a couple. So I've got one for like inflammation, for example, that's BPC 157 and the NA and the TB 500. Those are good in combination with each other, and they're taken for 8 weeks, and then you have an 8-week break, and then you kind of cycle them off and on. But those are really good for anti-inflammatory, anti-aging, those kinds of things. So that's an example of ones that I would like stacked together because they complement each other. IVs, we offer the IV therapy. Many of the peptides can be done through an IV as well. I also offer the vitamin IVs. There's an NAD IV infusion. I think I saw somewhere that Kim Kardashian's doctor was talking about it, so I'm sure there'll be a lot more people interested in that one now. That is a slow drip IV, so that is something you need to set some time aside for. So, and the reason why it's so slow is because it can make you feel kind of flushed, like a warm feeling. Sometimes your heart can race a little bit, so we have to slow the IV down to make sure that that doesn't happen, so you're not 4 hours long of feeling like that. So we kind of titrate it to based on how you're feeling, but typically it's about a 4-hour drip, and it's 500 to 1,000 milligrams of NAD. And NAD is best absorbed via the intravenous route. The second best is subcutaneous injection, and then the third best is oral. We have the monthly membership, so a monthly IV is included in that. You can do an IPL photofacial for that, or if hydrofacial is your thing, you can do that. That will be included in your membership. The membership is $129 a month. You get a discount on everything else. For example, filler is $150 off. Botox is $2 off. Dysport's $2 off. And Xeomin is $2 off per unit. In addition to that, you'll get 15% off any other products or services that we offer. I did start carrying Elastin product line, so that's a skincare line that is also through Galderma. It's a really nice line that you can only get through med spas. The number one product I recommend on there is their tinted SPF. It's like a tinted moisturizer SPF, and that's what I use every day. That's all I use, and then I use some concealer under my eyes and powder. But you're getting your SPF, you get a little bit of tint that has a little bit of coverage to it, and then you're also getting your moisturizing treatment with all those vitamins in there too. And that one's only like $57 or something like that, and you get a giant tube that'll last you probably a year or so. So that's a really good one that I love, that I use every day. Then along the lines of the monthly membership, you get that $129 a month. Say, for instance, you don't come in and get one of your free services, you don't lose that money. That money will stay on your account and can be applied towards any other treatments. So you won't lose it if you don't use it for that month. Other specials we still have new patient specials for Botox and Dysport. Botox is $179 for 20 units. Dysport is $4 a unit for the first 60 units. But that's for new clients, and we will offer those to them. So that's pretty much all I have for now. Let me make sure I'm not missing anything. All right. Did I miss anything, babe? He's not listening. All right. Does anybody have any questions? Hey, Jessica. Questions or comments? Going once. Oh, the body sculpting treatment, the M-shaped Neo also has an attachment that is a chair that you sit on. And I don't think I've talked about that before. So that is good for men and women to build the pelvic floor muscle. Mostly women are people who opt to do that. And you sit on the chair and it contracts the pelvic floor muscles for you, completely involuntary on your part. But that will help with like sexual sensation, but the main thing is going to help with is stress incontinence, which a lot of women have after having kids. So that, the weight of the baby and then pushing out the baby, even if you have a C-section, is kind of harms and weakens that pelvic floor. So you can get uterine prolapse, bladder prolapse, all kinds of stuff if that pelvic floor is too weak. Usually what happens is you sneeze and you pee your pants, right? So that's like the number one concern. So that chair, again, you do once a week for 4 weeks and then a monthly maintenance. For the chair one, we offer that at $99 per treatment. So I forgot about that one. I don't think I ever mentioned that to you guys. So anything else that I didn't think of? Nobody? Going once, going twice. All right, guys, this is a short one today. So I will see you guys next week. Have a great week, and feel free to stop on by or call us at 772-207-0080. You can also text that number. I'll respond to that as well. Or look us up on Facebook, Instagram, or our YouTube channel. I post these on YouTube too. So if you miss them, I think after they're on Facebook and Instagram for like 30 days, they get pulled. So they're all on YouTube as well if you guys want to look back at those. That's it. That's all I got. Everybody have a good night, and I will see you next week. You're welcome, Lydia. Have a good night.
Get away from me. Go. I told you. What did I tell you about that the other day? Huh? No. What do you think? What do you think I said?
Don't do that.
Right. When is it appropriate? Do you think it's appropriate when you're sitting on your ass? Do you think it's appropriate to do it when you're at the table? No.